we know what our medical costs are until it comes to surgery, and then we have no flipping idea because it can just absolutely suddenly. Well, we had this happen numerous times where somebody had some catastrophic event and they had a major transplant that cost $250,000, and that threw the whole budget off completely. So what's your talking points when you're talking to an employer about that? How do you talk to them so that they can understand that you can address this in a more logical way for them?
Right. So for an event like that, that's what stopgap insurance is for. But for other routine surgeries, like many orthopedic surgeries, many general surgery procedures, GYN, I can tell them ahead of time, even if they don't have the need right now or the patience to send us, I can sort of give them a menu and say, like, look, for a knee replacement, that's what you're going to pay. For arthroscopy, this is what you're going to pay. For general surgery procedures, here's what we offer, and we can offer more, but for the most common procedures, this is what you're going to pay. And they're going to see that these prices are much more reasonable and affordable for them than what they're given even best cash price at the hospital.
So when you guys do this, are you doing it primarily in local surgery centers, or where do you actually do the surgery?
Right. So we do the surgeries at local surgery centers. So like I said, there's like 5 or 6 centers across the US that are already doing this as a center, like the whole center does it that way. In fact, one of the centers that we operate at does it that way, but we're also going to other centers that deal with traditional insurance that may have time in the OR that's available, and in towns that we have a need for patients to be seen. And we partner with them and we say, like, look, we want to come do these surgeries. We're going to be billing the patient directly. We want to pay you for your time. You tell us, like, we're kind of leasing space, right? And we pay the anesthesiologist. So again, that from a patient standpoint, it's a single price, but we can open up shop anywhere. So just like the other centers, the way I describe it to everybody is like that's a hardware solution where they built a center at a location for patients to come. We're like a software solution, so we can go to where the patients are, right? So if there's like a few employers that have, I don't know, 100,000 lives, like it may make sense for us to open up a center close enough to that area to, and when I mean open up a center, is just develop a relationship with the local ambulatory surgery center to provide surgeries there. And there's a group of surgeons who are part of ACEs who travel all over. So, they may be located in one town, but we don't necessarily need local surgeons.
What's your coverage area?
So right now we're in 3 states. We're in Wisconsin, we're in South Carolina, and Connecticut. Um, we'd like to see more volume in South Carolina and Connecticut before we take on another location. But eventually we'd like to be, in all 50 states. There's really no reason why we can't go anywhere.
So when say for instance you're in South Carolina, what's the relationship between the doctors and do you offer the entire state of South Carolina that you'll go to virtually any location, or how does that work?
So we partnered with a facility in Charleston. So we hope that, and we've seen this in other centers. So like in our Wisconsin location, we've seen patients drive up to 9 hours to get their surgery with us because their employer was like, this is significantly cheaper, and the patients don't mind. They might stay overnight at a hotel post-op, just because it might be hard immediately after to be in the car that long. But patients are willing to travel for this. And, like I said, there's 6 centers across the US. They're seeing patients from all over. So we're in Charleston, but there's quite a few direct primary care physicians who I've spoken to who are in the northern part of the state, and they want me to come do surgery locally closer to them. So again, if the volume warrants it, we would do that. There's no reason why we can't do it anywhere